Hi, everyone. Hi, welcome. I'm Hospice Nurse Julie. In case you're new here, I normally do lives on Thursdays, as you guys know, but I keep having like brain farts on Thursday nights. I'm a little blown out. The lighting's a little off here, but I am here. So I'm doing a sort of like a makeup. No, that doesn't make it better. A makeup, a makeup live. So please come on in. If you see me looking down, that is because I'm looking at the chat. And if I'm looking up, I'm looking at the camera. So again, normally I go Thursdays live at 5 Pacific Standard Time. Yesterday, I did not make it. So I thought, you know what? I'm here today. I'm going to do another live. So let me know if you guys can hear me okay, see me okay. Hey, Rose. It looks like Rose joined the Compassionate Companions, which is a group I have here. Drinking a coffee. I tried really hard to get this lighting right, and it just is not working. My room is like far too dark, and like against the white wall, it just looks a little weird. Thanks, Steph. Hope you're feeling better. Truth, I'm not feeling that much better. I don't know if any of you guys deal with like migraines and kind of like inflammatory pain. I do, and it just comes and goes. So there's like I go like months without anything, and then all of a sudden I'll have like a lot of pain and migraine, a lot of issues for like a week or two at a time. And that's kind of what's going on right now. So it kind of really takes me out, makes my mental health a little crazy. I'm sure you guys can relate. I'm gonna put this mic right here. But stuff like this actually helps me. It helps me kind of get my mind off things. Hi, Glenda. Hi, Marta. Hope I'm saying your name right. Mary, Kitty, Steph, Brigitte, Brider Gillett. Okay, it's Bidergilette. I don't know how to pronounce anything. Hey, Jill. Hey, Wesley. An EMT. Oh my gosh, thank you for being an EMT. You're amazing. Someone's joining here from New Zealand, and they are a day ahead of us. February 1st over there. Hi, Arlene. I hope I'm saying your name right. Arlene. Oh, the further I go back, the clearer I think it looks. So can you guys hear me okay with if I'm sitting back like this? So welcome. Come on in. This is the place where you can ask me your questions. I do not read FB messages. No, I don't read any messages really. No messages. I would say the best way to get a hold of me is on a live like this. Hello from the Netherlands, my motherland. I do really feel like I look very much like I'm from the Netherlands. And it's because my family is. Peace out, Lisa. You're not missing my live. Makes me happy. Oh, Mary, that's amazing. Yeah, Mary said last night, because I missed the live, there was still like a chat going on, which makes me so happy, and everyone was being great to each other. That really makes me so happy. That's what I want. I want to like get a community of people together who can support each other, even when I continuously forget. Do you know why I think it happens? One, I'm pretty absent-minded, but Thursdays are a day that I usually don't have anything to do. It's almost like my day off, except for my lives. And I'm like, "Oh," and I purposely did that because I was like, "Oh, it'll be so great. Like, I'll have my day off, but then I'll do my live at 5 because I like doing them. It doesn't feel like work." But because of that, I keep forgetting to do them. So like when it was on Wednesdays, I had a meeting at 6. So I knew I had to do my live, and then right after my live, I had to go to my meeting. And like something about like kind of being busy helped me always remember that I had a live. Does that make sense? Any thoughts on making the decision to have a quadruple bypass for a person who's 86? You'd have to talk to the surgeon. I feel like that seems like a lot for 86, but if it's like a super, super healthy 86-year-old, maybe it's okay. I mean, I would not listen to a nurse on the internet, which is me. I would listen to the doctor who's saying yes or no. I would listen to the risks, see if it's worth it, talk to the person it's for, if the person wants to do it, it's up to them, right? But I wouldn't really listen to me. I would listen to the doctor who knows your case. I have a question from Washington Way. Can't I handle death? But when I was 4, I saw my grandmother pass away and was at peace. Oh, Howard, I missed the question. What's the question though? Oh, thank you, Marita. Is it Marita? Am I saying that right? Yeah, Lisa Jan. It is so difficult. I'm so glad you're here. Thank you for being here. Hi from Frankfurt, Germany. I love that I'm getting like all of these international people here. Karen. I'm just reading the chat. So if you see me looking down, it's because I'm reading the chat and then I'll look up and answer questions. If you do have questions, just ask them right away. And you can ask them in all caps if you keep trying to answer and it's not answering, and I'm not answering, I mean. Colleen says, my mother-in-law had a valve replaced at 86 and lived a good quality until 93. Sometimes it's okay. That's what I mean. Yeah. It's like you never know. And ultimately, if the person who is supposed to be having it wants to have it, by all means. Now, if they're like in really, really poor health and needs a quadruple bypass, I think it's a little iffy. But also, again, do not listen to a nurse on the internet. Listen to the doctor who knows the case. Oh, Howard, I see. I was at peace when my great grandfather passed when I was 4. Now I can't handle death at all. I go into a deep depression. I mean, it's not uncommon for people to be afraid of death and to not want to think about it or go into a deep depression, like you say. But also, it could be a lot to do with our mental health, right? Maybe this is just the thing you're fixating on. So, at the end of the day, like I am not an expertise at grief or mental health. Like I don't have I've witnessed to it a lot, but I don't have expertise in that. But I would say just like person to person, I feel like it's always good for all of us to try to reach out and get help, whether it's through a support group or through a therapist or just through this talking about it, no, normalizing how you feel. But I see a therapist every Tuesday at 10:15 and I love her. I do believe in an afterlife. I did just post a video about this that gets some heat because a lot of people want me to like have a specific religion and I really don't. And it's just my belief, but I do have a belief in an afterlife, but I realize it's just my belief. I would never try to make someone believe in something or think they're wrong if they believe something else. But I do have a belief in an afterlife. Do you ever see hypoglycemia end of life? Do you address it? We don't really check sugars at the end of life. So, for the most part, the body is shutting down. The last thing we're really going to do is check blood sugars. Now, if someone's type 1 diabetic and they've been their whole life, we do continue to manage that, and they usually manage it because they're better at it than we do. But generally speaking, we're not going to be concerned with hypoglycemia. I'm just reading through the comments. Thank you so much for being here, you guys. Welcome. Come on in. Do you like nerds? I mean, Richie's kind of a nerd. Is he still here to hear this? So I suppose I do like nerds. Do you think science will ever be able to keep people alive as long as they want or live forever? I think so, probably. Not in our lifetime, I don't think. And it'll probably look much different than we ever thought, but I bet so. Maybe. I don't know if they'd keep the body alive, but maybe transferring consciousness, something like that. Thank you, JR. Jen R, not JR, Jen R. Why do you guys check blood pressures if you don't really do anything about it? I usually don't. And we kind of have to. We're supposed to technically check blood pressures. But at the end of the day, if someone's like not actively dying, I check it because if someone has a high blood pressure, we would do something about it. Low blood pressure, as long as they're lucid, it's okay. And also, if it's a low blood pressure, but they look comfortable, there's not much to do about it anyway. But you're right. I mean, to me, I always say like vital schmitals. I don't really care about vitals, particularly if they're comfortable. If they're not comfortable, I might check some things to see if there's anything we could do about some stuff. But generally speaking, vitals are like the last thing I worry about. I go by how the person looks and what they're saying. Cancers definitely can be all types of diseases, not just genetic. But I believe in scientific research that's studied and proven. I think Western medicine gets I give it a lot of crap, but generally speaking, it does amazing things. And I believe in Western medicine. I believe what our healthcare providers tell us. I believe in studies, what studies have shown. So I'm not super crazy about alternative therapies. I think it's okay. But if it's not scientifically proven, I wouldn't I wouldn't look that far into it unless you really want to and you think your body can physically do it. I do still work as a hospice nurse, just only per diem, so not as often. I don't work full time. As a hospice nurse, I work full time doing this stuff, but not as a hospice nurse. How do I deal with the emotional side of end of life? I It doesn't fully bother me. I know that sounds crazy to people, but I was an ICU nurse for so long, and seeing people die in the ICU really made me passionate about understanding death and knowing that it's not the worst possible outcome. And so it doesn't necessarily make me super sad when people are dying. So it makes me feel like we're doing a good service to something that's going to inevitably happen. So it's not super hard for me. It feels good. I mean, I don't like that people are sad, right? But it does feel like I'm doing something that's worthwhile. Nikolai, I'm glad you're here. Glad you're here. Just reading through the comments. What about leaving a body for science after you die? Do you agree with that? And how does that work? Do you know anything about it? I do agree with that. You'd have to get in touch with You have to get in touch with probably different universities, different teaching hospitals. The lighting in here is kind of killing me. Different teaching hospitals. So you would have to set that up yourself, but there are different teaching hospitals throughout the country that will take dead bodies. So you can donate your body to science. I was given 18 months. Now what? You have to ask yourself that question. Yeah. Now what? That is the ultimate question when faced with the reality that you may die, right? You've gotten a disease, you're given a prognosis. What do you do now? What do you do now? And I think the best thing you can do to start is talk to your family and friends about what you want what you want, if it's real, if this is true, right? I mean, it's real. I know it's real, but I mean, like, if it's the reality that you likely have less than 18 months to live, how do you want the 18 months to look? Like, what do you want people like, tell your family and friends if you don't want them to say stuff like, you can beat this, you got this, you whatever, right? Let them know like where you're at, what you want. You need to give someone durable power of attorney over you, power of attorney over your finances. Work with an estate planner, even if you don't think you have an estate to plan. Speak to your loved ones, speak to your family, and try to live in the day that you're in, and try to live and do all the things that you've always wanted to do, say all the things you always wanted to say. That's what I think. I think it's time for living now. And the best way to do that is to plan for your death. The best way to do that is to plan for it, is to expect it, is to acknowledge it. And that's not just going for Nicole. And Nicole Dingle, I hope I'm saying your name right. That's for all of us. That's for all of us. We're all dying. We're all going to die. And some of us might have a diagnosis that tells us when, right? But that doesn't change the fact that we're all dying. So all of us need to live and do as if we were, right? And that's not meant to be scary. That's meant to motivate us to put things into perspective, figure out where our priorities are, um, and learn to live in the day that we're in. I hope that helps a little bit. In his service, I'm glad you're here. I'm glad you're here. I don't actually get nausea and vomiting during my periods. Some people do though. I would talk to your gynecologist. See what you can do. Been on chemo from the beginning. Family doesn't want me to stop, even after doctor said nothing left to do. I'm so tired. You need to get the doctor. If you can, get a family meeting together with your doctors and your social worker. Get a social worker in there to get your family to understand where you're coming from. Okay. You can send your families my videos. You can send them my book. Where is it? My book, Nothing to Fear. Of course, you're tired. You're probably tired of people don't know how to support people who are getting near the end of life. It's hard. It's really hard. I'm so glad you're here. I don't know if this is your first time here, if you've been here before, but this is a good place for you. This is a good place for you. Thanks, Queen of Green. Elgato, I cannot help you with your broken leg. I'm sorry. My mom's been in the hospital since January. She ended up code blue 112 in the ICU. She ended up being diagnosed with thoughts. It's too hard for me as a person on the internet to really give thoughts on that. My thoughts would be talk openly with her doctors in the ICU. It depends on her age, it depends on what they're saying. I don't know how old your mom is, but this would be a time to start openly talking about what they think her like. Is she going to be able to get back to baseline? What's the plan here? So I would openly talk to um, the doctors that are taking care of her now. Ask for a family meeting with a social worker to talk about next steps and what the future holds for your mom and what they think the best plan of action is. Hi, Julie. Do you have advice for moms who spiral because of death anxiety? So, listen, I do think my videos and Hospice Nurse Penny's videos will help. I do think our books will help a little bit. But generally speaking, death anxiety isn't really about death. It is ish, but it's mostly about anxiety and control. So, I do feel like there's help out there, and therapists are amazing. There's nothing wrong with getting therapy to help overcome something like that. I do think it's more about anxiety and control versus like the actual death thing. And it could be, but generally speaking, you can try to watch our videos, you can try to read our books, and many people have told me it really, really has helped. But also, like, if it's not helping, please know there's more help out there. There are trained professionals that know how to deal with stuff like that. I'm just reading through the comments. Excuse me. Liz says, sorry, question is how to know when to throw into the towel or when to keep fighting. Liz, I just did a video about this. I just did a video about this. So I would go to my page, Hospice Nurse Julie, and I think it's like two videos down, and I think it says like when's enough's enough or something. It's a couple videos down in my video section. You'll see it. So I would go look at that. The PPS scale is something we look at that helps us see how deteriorated someone is functionally. So, someone with like Parkinson's disease or dementia, we like look at the PPS scale to see where they are. Like, how often are they walking? Can they walk? Can they bear weight? Are they incontinent? Can they speak? There's things like that. And then we look at that. Hey, Bermuda. Welcome, everybody. Come on in. I'm Hospice Nurse Julie, in case you don't know. There's actually a heart at the bottom corner of your screen. And by tapping that heart, or even it helps the live somehow, some way. I don't know how, but it does. So if you like what you're hearing, please help me out. How do you manage the stress in the ICU? I didn't. That's why I quit after 8 years. It is so stressful in the ICU. It is so stressful. Welcome, everybody. Come on in. If I haven't answered your question and you are trying to get me to answer a question, write it in all caps. It'll be easier for me to see. If you're new to my channel, I'm Hospice Nurse Julie. I educate about death and dying. I wrote a book. It's called Nothing to Fear because of you guys. It's a New York Times bestseller. Thank you very much. So that's also an option for you. I release videos twice a week. And in a couple months, I'm going to be putting out some classes through a company called Pessy. That it is going to cost money, but if you do want to take more classes and get educated, you can. Good afternoon, Zachary. Hi, everybody. Welcome. I'm doing a live. I usually do lives every Thursday at 5 p.m., but yesterday was a wacky day, so I missed it. So I'm just doing one today just to make up for that and say hello and see who I can talk to. Lisa says, hi, Julie. My aunt called my grandma. They are both dying and told her they are calling her and that it's time to go. Wow. That's like vision. That's kind of like visioning. Oh my gosh, Queen of Green. Thank you. Lisa says, talk about AMS and lactulose. We need education on that. My guy almost died. I thought he was just drunk. So lactulose can be taken if you have too high of ammonia levels. Ammonia levels build up when your liver is not functioning, and it can make you act really, really goofy and weird. Then you take lactulose, it binds to the ammonia, and then you poop it out, and you can clear you a lot, so you're not as confused. Oh, thank you, Liz. I'm so glad it has happened. It's helped you. Someone was just talking to me about death anxiety. So Liz says my videos have helped her. So that's really great. Helen, I'm glad you're here. I'm sorry your mom's in the hospital. Have you ever encountered someone drinking alcohol or smoking illicit drugs while on the job? Other nurses? No, I have not. I have not experienced other nurses drinking alcohol or smoking illicit drugs while on the job. I have had patients do that, and I'm okay with it as long as they're safe. How do you manage your own emotional well being while dealing with death on a regular basis? So I am in recovery. I'm in a 12-step program. So that program that I work on a daily basis really, really helps me. I also have, because of that program, I have a pretty good social life. So I feel like I have a well balanced life. I also work for a unionized hospital. So we don't get overworked or underpaid. I also have worked really hard on boundaries. So I have really good boundaries when it comes to work. And remember, I was an ICU nurse for many years before I was a hospice nurse. And being an ICU nurse really changed my perspective. So being a hospice nurse doesn't feel really hard to me because I believe in it so much. Both my parents are full code, clinically poor health. My dad just broke his hip Sunday. I have multiple conversations about code status and DNR. Any suggestions? I would suggest if you've already had multiple conversations and they're like truly not hearing you, one, you can just respect what they want. As awful as that sounds, because I know that it's probably not the best thing, but you can just respect what they want if they truly are saying that. You also can ask if you're in the hospital or you're seeing a doctor to have them say something to them and describe what it actually means. Another way to bring it up, I think, would be to talk about how you knowing what they want at the end of life can help you. Like them telling you what they need and want will help you if they can no longer make decisions. And you could even say something like, hey, I was watching this educator online and they were telling me how CPR can be really violent and it's really meant for like young, healthy people. And it it's not really effective for um, people over a certain age and with a lot of health issues. It can be actually more damaging than helping. So it's not like you see on TV. Generally speaking, if you've already kind of done all of that, you have to just let them have their own journey, as hard as that is. How do you manage your own? Okay. Are there any states allowing or considering MAID? There are 11 states that allow medical aid in dying. It's not like it is in Canada where the doctor actually injects someone with medicine, but it's a powder that you mix with liquid and can drink. And 11 states in the U.S. Have that option. I've made several videos about that. If you want to go check out my page and look for death with dignity or medical aid in dying. Alberta, Canada here, had COPD for years, put on palliative care. Doctor gave me, I'm past that date, off palliative care. Now what? Now you just got to live your life. That is kind of how it works with palliative care and chronic illnesses like COPD. It's like you're going along, something happens, you decline so you can meet criteria to be on palliative care. Then you go up, 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 and get better. And then you have to come off palliative care. Then you're going to go on with your life. And then eventually something's going to happen again, respiratory infection. You end up in the hospital. You'll go back on palliative care. And it's kind of just like that. I'm not saying it's fair, but that is how it's like that. They're not doing anything wrong. I do have some patients with pulmonary fibrosis. For some reason, a lot of patients with pulmonary fibrosis tend to die in the hospital. I don't know if it's because it is a difficult disease to manage, and the hospital can do better at managing it sometimes. So I don't know why that happens, but we do have some patients with pulmonary fibrosis come on to hospice. However, it's usually very, very end stage once they do. Kelly, did you get my email about my mom? She has just passed from cancer. Um, from sorry, hold on. From diagnosis, lost breath, 3 days. Please could do with some help. Kelly, I'm so sorry if I did get the email. I either read it or it's really hard. Unfortunately, I get tons and tons of emails, so I can't really read them all, specifically if they're super long. And then I can't and then even if I do read them, I can't necessarily answer them. So, you can try to ask me the question here, Kelly, and ask it in all caps so I can see it. But at the end of the day, I would talk to so I'm gonna try to answer it here, but if I can't, I would talk to the doctors that worked with your mom. They might be able to better answer questions for you. Someone dying with heart failure, it usually takes very many, many years, depending on how bad the heart failure is. It's one of those like chronic illnesses. It can definitely be if you're on hospice and you guys are all willing to let the body be the guide, it can be peaceful. However, there are symptoms that come along with heart failure, usually shortness of breath and debility, meaning they can't really get up and do things. So they will be like, um, and then they have dementia too. So they will be like fully dependent on you, which can be really hard. So that can be really hard. But we definitely can help with symptoms. Thank you for the $10 tip. I just bought your book. Thank you for caring. Wow, thank you so much. I want a glass of wine at the end of at the end, if possible. I have 7.5 years sober. Thought, whew, I get that. I mean, if you're sober, it's probably for a reason, baby girl, just like me. And I'm sure I would want a glass of wine too. But the problem with that, and tell me if I'm wrong, I don't ever want just a glass of wine. So I always think that too on my deathbed, am I going to drink? And the answer is probably, I mean, who knows what's going to happen in my life, right? But I think my answer is going to be no, because I know, as an alcoholic, at least for me, that when I drink one glass of wine, that clicks in that trigger in my brain that now clicks over into obsession. And now I want another glass of wine and another glass of wine and another glass of wine. And even if I don't have those glasses of wine, I'm still obsessing about the glasses of wine. And now I'm no longer present with my friends and family who I want to be present with. I'm thinking about the second glass of wine. So that's why I don't want to. But at the end of the day, it's up to you. Donna, that type of cancer does not stick out to me, but I definitely had patients with thyroid cancer, but maybe not. I don't know what kind of thyroid cancer, but I do see that very few and far between. I have experienced death outside of my job, but all the deaths that I've experienced have been sudden deaths from friends. Hi, Julie. My dad has stage four and oh God, letters all together I can't ever pronounce because I'm dyslexic. Let's see if I can do it. NSCLC. He has 6% chance to make it 2 years. He lived 5. Doctor told me he would die of a really bad seizure. He passed in his sleep. I'm so sorry, Stacy. Did you? I could be reading it wrong, but I don't know if you have a question about that. A lot of people who are sober here. That's amazing. Both parents have experience communicating with someone who is deceased. They're not crazy, but it happens more than once. Yeah, that's definitely a thing. It's called visioning. I see it a lot too. I'm almost 37 years sober. I still have dreams when I'm drinking, drunk, or about to drink. I feel ashamed in the dream. Yes, I get it. I get it. I still have those too. I'll have 9 years of sobriety February 4th. Can't wait to celebrate. I don't know if I believe in reincarnation. I don't not believe in it. Like I would like for there to be I would like to be reincarnated, I think. Maybe not once I get back to the place that I call home. Maybe I won't. Oh, okay. Thanks, Stacy. And thank you for being there for your family. I do have experience with end stage bile duct cancer. Yes, I see many patients on hospice for that cancer. It can be a hard one, just in the sense of symptom management. It can be hard. Did you read my question? If I didn't answer it, I did not read it. Blessed one. If you have it, just write it in all caps and hopefully I'll see it. I do believe in life after death. I made a short video about that. It's on my page um, about what I believe. And I post it's in my shorts. It's in my YouTube shorts. Kat, thank you for reading my book and you're definitely not too late to become a hospice nurse. Oh my god, no. No, no, no. Lisa, congratulations. Welcome everybody. Come on in. Hospice Nurse Julie, in case you don't know. Yes, I do have experience with pancreatic neuroendocrine cancer. Yes. All the cancer. So if you're dying from cancer on hospice, besides a few, most of them will look somewhat the same. Somewhat the same, in the same trajectory. You've already gone through this long haul of like trying to do chemo and radiation. At the end of the day, most cancers will have pain. Some will have shortness of breath and confusion. We can manage all of that. It's just a matter of managing it with medications. So, Jana, with stage 4 bile duct cancer, is this person on hospice? I wouldn't focus too much on the low blood pressure and low body temp. I mean, it can be a thing. Usually with bile duct cancer, their liver's involved. When liver's involved, they can have low temperatures. Um, if they're on hospice already, that means they are close to death because they are on hospice. If they are not on hospice because they don't choose to be on hospice, they still could be close to death. It's really hard to know. I would not go off of, I love educating online, but as far as like knowing when it's going to happen, unless you're my patient, like it's really hard to know, right? So talk to the people that are caring for your loved one. Talk to the people that are caring for your loved one. Generally speaking, someone is close to death if they have a terminal illness and they are sleeping more than they are awake. If they don't eat and drink or only take like bites of food. If they can no longer walk, right? Like these things would say they're getting closer and closer to death. But when someone's further out from death, even if it is only 6 months, that still seems like, yikes, that's really close. But that's still too far away to really make any kind of predictions. So um, I wouldn't necessarily say low blood pressure and low body temp indicates end of life. There has to be more things going on, but I would definitely talk to the doctor that this person's working with. I was asking about my husband. He passed. He didn't get the end of life signs. He just trembled a little, stopped eating. His tongue went to the top of his mouth. He was only in hospice 2 days. Blessed one. Yes, everyone can, every once in a while, someone will do their own thing. They will do their own thing and die how they want to die. So, not everyone, almost everyone would, but not everyone always um, has all of the end of life symptoms. So what happens if the body does not die if it dies from an accident, gunshot, how does it shut down? It depends on what they're dying from. If it's like massive blood loss, blunt force trauma to the head or something, it's usually more sudden and it's dying because of the accident. So it wouldn't necessarily go through all of this shutting down systems like it does if it's dying a little slower. So it's hard for me to talk to all of those things, because it depends. So gunshot would likely be because they've lost a lot of blood or something. So hypovolemia can cause you to die, or blunt force trauma. Your lungs are crushed or your head is crushed. Like, not to be super graphic, but so it just depends. And it's much different, but it usually is sudden and probably not very painful because it's so sudden. Your body's really good at putting you in shock pretty quick so you don't feel anything. Do you talk about life after death in your book? A bit, yes. It's definitely a science it's definitely a learning book where you learn about things biologically, but I do talk about some belief in an afterlife, but it's never me trying to like tell you what to believe. It's just from my experience. Explaining a near death experience to you loved one is very hard to do. I'm still not sure if what I saw or if it was just the meds. Yeah, it can be hard. I've had some weird experiences on hospice too, and it's hard for me to talk about it sometimes as well because it's like, was that real? It felt really real, but I don't know. How do you deal with moments of doubt when you feel uncertain about whether you've done enough to support a patient and their family emotionally? Oh, it's so hard. I usually have to take a break sometimes. Sometimes, like, that's why being a full-time nurse is super hard because you don't always get the break. You have to remind yourself that you're human too. You can't do everything for everyone. Hence why boundaries are so important to learn and understand and truly believe, knowing that whether you did enough or not, you did the best you could in that moment. We are still human and we can't do everything for everyone. And I've definitely had to learn that. Like, some people don't want to hear what I have to say, even if I think it's going to help. I mean, I've had plenty of patients not have good deaths, and it's because they don't want to hear what I have to say. They don't care. They want to do it the way they want to do it. And I have to accept that sometimes, even though it's really hard to watch someone suffer, knowing they don't have to, but they will choose to because it's what they want to do. And I cannot take responsibility for that. So, but that's really hard. That's really hard. And it takes time and you can still feel really bad about it. Um, for me, if you're a full-time nurse, I would say take some time off, even if it's just a day or two. Even if it feels like, oh, I can't do that. I'm too busy. I have too many patients to see. Nope. Take time off. Take a day off and like take care of yourself. That's what I think. Welcome everybody. Come on in. Let me know if you have any questions. Try to type it in all caps if you can so I can see it. How often do you actually get nurses coming to your house when you're on hospice? So, Medicare standard is once a week. So, they only have to come once a week. They will come up to every day if there are issues. And by issues, I mean out of control pain, confusion, shortness of breath, something going on, right? They do not have to be there to do what they would call custodial care, which means like just taking care of someone day to day. That's not their job, unfortunately. Unfortunately, because it falls on the family and it's a lot of work, and a lot of the families think that is the nurse's job, but it's not. So, really, you only need, they only legally have to be there once a week, which a lot of people are surprised about. How is shingles treated in hospice? If the person can still swallow, they should be treated with antivirals and pain medicine because shingles is painful as shit. I have not heard of Emanuel Swedenborg. Take a break, Julie. Thank you. I'm going to. I really don't work as hard as you guys think I do. I really don't. If anything, I probably could work a little. I probably have I probably do a little better if I had more of a schedule. Yes, hospice does 5%, family does the rest. Amen. Yeah. And I love hospice. You guys know I do, but no, per Medicare guidelines, it's up to the family. What if the patient isn't on Medicaid on the US? Can you still get hospice? Is it expensive without Medicaid? Um they would have to have some type of insurance or Medicare or Medicaid. If they don't, they'd have to find a hospice to do it pro bono. Otherwise, you probably couldn't do it. Do you go to therapy? I do go to therapy every Tuesday. And guess what? I never talk about my job in therapy. I talk about so many other things. How do I get my dad and hospice to connect and stop playing phone tag? I feel like I'm in limbo right now. Ugh, so hard. I don't know. Maybe try a different hospice company because if you can't get a hold of them, that's a bad sign. Thank you, Amy. There are CNAs that work in hospice and they're amazing. Yeah, there's a whole team of people. So it's not just the nurse. There's a doctor that is really involved in the care. They're just not there physically. The nurse is like the eyes and ears for the doctor. There's a CNA who comes and helps keep the person clean. There's a social worker who helps with so many things. There's a chaplain helps with so many things. And then a lot of times they have a volunteer program as well that will help. So I would utilize the whole team if you can. Utilize the whole team. This is definitely like an all hands on deck kind of time. I would just keep trying to call that hospice number, Clary. If that's your, I'm sure I'm saying your name wrong, but and also maybe think about going to a different hospice because, like, why the heck are they not answering? Queen of Green, thank you so much. Have a good day. Listen to it. Look at you guys supporting each other in the chat. Thank you for being like that. Thank you, A Wolf. Thank you for being here. I was thinking about being a hospice volunteer. How would I do this? Amy, I have a video about this. I'm going to tell you how to do it, but also check out my video. It's on my page and just look up volunteering. It'll be right there. I would Google all of the hospice places in your area and then look into their volunteer program. So many will be, they'll be great. So make sure you see how they usually utilize their volunteers and see what their training program consists of, because many will have to be trained. And that's how you do it. Thanks. I think it's the SWI, Dad's nursing home, not the hospice. I see. You can, yeah, yeah, yeah. Nursing homes can be so hard, and it's not totally their fault. They're like super, super, super overworked. They have so many people to try to take care of and so many things to do in one day. So it's not fair to you, but it's also not fair to them. Our healthcare system is horrendous. Okay. You know whose fault it is? The person who owns the nursing home and only hires one social worker for the whole place. That's whose fault it is. Let's look up the CEO of that hospice, of that nursing home, and let's all call them. You caught me on a bad day, you guys. I'm out for revenge over here, okay? Oh God. Preach. Yeah, thanks, guys. Let's call that nursing home. That's right. That's right. Let's all call. Excuse me, we are trying to get hospice for this wonderful patient and their family. Do you think AI can help in this discipline? I don't know. I don't know anything about Kitty Cole says number. We are all like we ride at dawn. I don't know anything about AI. I'm only 42, which is young, but I still feel like way behind when it comes to that kind of stuff. I have no idea. AI helps me come up with some video ideas. Maria says, I just got your book tonight. We'll be watching your live. I'm looking forward to getting more insight. Oh, thank you for buying my book. That's so amazing. How does hospice work in nursing home environment? So the nursing home again does most of the work. And the hospice company will come in and work with the nursing home to help make sure the patient gets everything they need. But the day-to-day care will still fall on the nursing home. Going to see my mom in diapers at the sniff for the first time 2 weeks ago was the hardest thing for me, but I also felt all the nurses, CNAs, and healthcare workers. Oh, it's so hard, right? It's so hard seeing your loved one change and like how their dynamic changes. And yes, they look so vulnerable. It's so hard. I'm glad you can be there though. That's why I feel like it's so amazing to work in hospice because I see such great acts of love. I know how hard it is for families to see their loved ones in a different light, but they still do it and they still go and they still like do the hard thing. And it's really inspiring and beautiful to watch. So thank you. Yep. Hospice is for care and comforting and comfort, not for caretaking. Very true. Very true. I did a whole video, I don't know if it's out yet, I can't remember. I think it's out already, about what to expect with hospice, and, like, why are so many people, disappointed by hospice, and it's because their expectations of what hospice does is wrong. So the hospice company is not really doing anything wrong. They were just told or had this different idea of what hospice was supposed to be. And then hospice does what it actually does, and then people are pissed. Um, so hopefully that video will be helpful. I had to see, I think it's out already. In your time working with patients and their families in hospice care, what's the most unexpected lesson you've learned about yourself that you didn't anticipate when you first started this work? Girl, what a question. I love it. I didn't think I would love it as much as I do. I didn't think I would, let's see. I didn't think I would love it as much as I do. I didn't think I would grow to be such an advocate for trying to help people understand how to die and like how our body helps us do it and how education can really free us from the fear. Like none of that was like on my bingo card, you know? Honestly, when I first started hospice, I was a burnt out ICU nurse who was still an alcoholic and was like looking for an easy job. That's like kind of where my head was. Not totally, but like I was just so burnt out and I was still drinking a lot. And it was like, ooh, I can be hungover and like, oh, this is like so much easier, which is not true, but at the time. So it's like I kind of had somewhat If I look back at the time, I wouldn't have said this, but now if I look back, like my intentions like weren't the best. And then just through watching it, it's like, oh my God, this is the most beautiful thing I've ever seen. It's not really sad. It's beautiful to see the body take care of itself. It's beautiful to watch the family take care of their loved one. It's beautiful to see this love. Um, so it's like changed everything about me. And then I got sober and then I got really into it. Um, and to understand that like talking about death is the one thing that can really help you live better and die better was really profound to me because I didn't know that. It's really long-winded. That's a great question. I'm gonna make a video about that, I think. Thank you for asking that. I love putting on makeup. PS, this is a side note. I love putting on makeup. I love it almost feels like artwork to me. Like I love putting it on, but I hate wearing it because I can like feel it on my face. What if someone needs hospice, but they don't have a caregiver? They can care for themselves as long as they can. Once they stop being able to care for themselves, we legally, as a hospice company, have to like make them go somewhere to get care because we can't like physically see that you can't care for yourself and you're living alone and like let you be like that. So usually they have to go somewhere or pay someone if they have the money to be their caregiver. Do you think your experience being a hospice nurse played a role in you getting sober? I don't think so. I don't think so. I think my life, just how my life was, played a role in me getting sober. Well, I guess maybe a little bit. There's like so many things that played a role into getting me sober. Um, so yes, a little bit because I think I'm gonna write a second book actually, about some of this stuff. Um, because I can remember I've never gone to work drunk or high or anything like that. I've never done anything like that, thank God. But I have gone to work very hungover. And I have like thrown up in my patients' bathrooms because I was so hungover and so sick from the night before. And of course they didn't know what was going on. I just said, "Can I use your bathroom?" Right? But like the incomprehensible demoralization of that, knowing that here's this like lovely patient and their family who like love me and I'm helping them and they're dying and they're going through such a hard time and they're still so amazing and so loving to me. And then I'm being like, "Excuse me," and I have to go vomit in their bathroom because I'm so sick and hungover. After doing that several times, that was one of the catalysts to be like, something's wrong here. Something is wrong here. I cannot be doing this. So that's one of the reasons why I started being like, something's up. But there are many other things too. Many other things too. I which I can get into sometime. Like I'll start doing yeah, as you see, I'm doing more and more videos about being sober. And I'll have 9 years next week, February 4th. 9 years. So yeah. Yay, 9 months sober for me. That's amazing. It's a great question, Michelle. Thank you. Thank you to everyone who's talking to each other in the chat. It makes me so happy. I'm finally like waking up a bit. I don't know if you guys, I don't know who's been here the whole time, but I feel like the first half of the live, I was like really dragging. Something's going on with me, like physically. Um, yeah, I don't know if it's like my headaches or what, but I'm just a little bit out under the weather. You know what I mean? Jelly bean. Have you ever cared for someone dying of alcoholism? Yes, many, many people. If so, what was that like for you? It's very, very sad. It's very, very sad, but there is no judgment. I fully understand. I fully relate, and I personally believe that alcoholism is a disease. It is a disease, and they're not my loved one, right? Like I have other loved ones who are not sober, and it's hard for me to see what they do as a disease, because I take it personal. This is my loved one. How could they be doing this to our family? All the things. But when it's not my loved one, I need to give the grace and love to everybody. But it's easier for me to do that when it's not my loved one. Um, so yes, I've taken care of many people with end stage liver cirrhosis due to alcoholism. And it's super, super sad. And I don't talk to them about anything about getting sober or being sober. It's not the time, it's not my place unless they ask. If they ask, more power to them. If they don't, I don't say a word. And many of them continue to drink. I mean, it's too hard. It's usually physically too hard towards the end to drink because they are fully disoriented. They don't know what's going on. They can't keep anything down, let alone try to drink. So, but it's sad. It's sad. When we had hospice for my father 25 years ago, we were able to have a nurse stay for a 4-hour shift so my mom could sleep. I was in does hospice still do that? No, they don't do that. They don't do that, unfortunately. 25 years ago, it might not have been covered by Medicare. And if that's the case, then it was a whole different ball game. It's like once Medicare got involved and now Medicare covers everything, it's a good thing because we have so much more we can provide, but also a bad thing. It's like there's some negative parts to it because the bad part is we can only do what Medicare says we can do. And Medicare does not say we can relieve someone because they need sleep. That's not allowed unless the hospice company wants to pay for that on their own, which many don't have the ability to do that. So, yeah. Living with Ivan. I need to go, Ivan. The live is done, but if you look through my videos, I have many videos about what it's like to die from kidney failure. So just go to my page, Hospice Nurse Julie. It's free. Go to videos and then just look at all the thumbnails. It'll say what it's like to die with end stage kidney disease, I think. Ooh, Megan. Megan, is your name Megan? It is. I don't think it's spelled like Megan, but it looks like Megan, and I'm just dyslexic. It's like Magna. It's like Megan, but the A and the N are switched. Anyway, she has great questions. This is the last one I'm going to answer, and then I'm going to go. What has working in hospice taught you about living? The number one thing working in hospice has taught me about living is to appreciate my health while I have it. To me, it's not about to me, like, when I say, like, knowing we're gonna die, how will help us know how we want to live. And I don't mean because I think many people think, "Oh, if I'm gonna die in 6 months, I'm gonna travel to New Zealand. I'm going to spend all my money. I'm going to go on a shopping spree. I'm going to, all these things. I'm gonna jump out of an airplane." I don't think that's what investigating and accepting and understanding death needs to do. What it has done for me is help me appreciate and reevaluate my day-to-day living. Like it's like because I have such a great understanding that we're all going to die, including me, and that we're all not even if we're not going to die, we're not going to always be healthy. It helps me appreciate the day that I'm in and the health that I have in that day. And when I do that, I can appreciate beautiful, amazing things like being able to look at a tree and see flowers, being able to like feel the sun on my face, being able to like hear my sister laugh, being able to walk down the street and get coffee, like sipping coffee. So it's like that. Those are the things that I think make life meaningful and they're really easy to glaze over. And I do it all the damn time, but I try not to. And I'm actually even thinking about doing things like making a meditation for people to listen to every morning so we can help get in that mindset of like every little moment is precious. So yeah, that's what it's helped me do. Do you think lorazepam is a good thing for alcohol withdrawal? Yes. There are many good things for alcohol withdrawal. If someone is an alcoholic and they've been drinking every day, do not just stop drinking. It's very, very dangerous. You definitely need to detox and talk to someone and a doctor to help you do that. Okay. Join me next Thursday. I'm not going to forget. Do you want to know why I'm not going to forget? Because I now officially have set oh, you know what? Don't join me next Thursday. Next Thursday, I'm going to be at a conference. Oh my God. You guys, I'm gonna be at a conference, enlarging my brain so I can bring information to you. Maybe I'll try to do it at the conference, but later. I'll keep you guys posted, okay? Okay. You guys, thank you for I was in a little bit of a funk, and you guys got me out of it. I appreciate you guys so much. Really. Mwah, mwah. All right. I'll see you next week sometime. I'll keep you posted on my page. Okay? All right. Bye, guys.